Welcome to Focus on Liberia. My name is Dennis Jai, and we are broadcasting from Atlanta, Georgia. Tonight, our topic is mitigating the incidence of rape amongst children in Liberia. My guest is Mrs. Rachel Boiseji Chapin. Rachel, welcome to Focus on Liberia.
Thank you. Thanks to your team on the platform, Dennis and Anthony. I'm very much pleased to be part of the platform tonight. And hello to all the listening audience. Thank you very much.
Thank you. Rachel is joining us from Melbourne, Victoria, that's in Australia. And I believe that right now it's 7:11 in Atlanta. Rachel, what's the time there in Melbourne?
It's 9:30 a.m.
That's Saturday.
Yeah, 9 a.m. It's past 9 a.m.
Okay, we are still having Friday here. You Saturday in Australia.
Yes, it
oh,
is.
Wow. Well, Rachel is a physician assistant, or also a public health practitioner. Her area of intervention is in health and social justice. That include research, evaluation, and program management. We're going to be doing something more like a teaching session tonight on how do we bring the rape cases among children down, and what are some of the intervention strategies? What are some of the preventive measures that we can take in order to mitigate the incidence of rape amongst children? Rachel is going to be sharing tonight, and we want to welcome all our viewers from across the globe. The issue of rape is so alarming right now in Liberia. Whether the cases are going up or more of the cases are being reported is not the issue, but the issue is rape is rampant in Liberia. It is a criminal behavior. It is victimizing a lot of people. It has a devastating impact on the individuals affected and also the society as a whole. So we at Focus on Liberia, we want to give it more spotlight. We want to be talking about rape, and with the hope that positive things are going to happen in Liberia, and this madness will one day be history. Rachel, let me start by saying just a little bit about yourself. I've known you for some time now, but my audience don't know you to that extent. You've also been calling on our platform here, and so we are very glad to have you as our guest. Just a little bit about yourself before we can begin.
So, okay, you already called the name, Rachel Boiseji Chapin. I'm from Riverside, originally in Liberia. And professional-wise, I work extensively in the field of public health for more than 10 years in Liberia, working with local organizations, international NGO, in government of Liberia before coming to Australia to study the Masters of Public Health. I now reside in Australia. I'm a mother of 4 children, 3 girls and a boy. Yeah, and things that I'm passionate about humanitarian work, reducing the burden of disease in our communities, reducing those social problems in our communities. I'm very passionate about that. In terms of research, I've worked along with other researchers on a number of research, but personally, 2 major research that I did in Liberia. That is the pharmaceutical system in Africa. I did a formative baseline research for intervention for medicine stores to serve anti-malarial medication. I also did a research independently for the malaria control program, where I evaluated the strategic communication messaging plan. So the malaria control program had the strategic communication messaging plan to prevent and control malaria. So I evaluated that in 2013, right before coming to Australia. And I done a lot of consultancy also, where I did another consultancy along with WG Consultants in Liberia, where we did the risk perception survey for HIV amongst workforce. Yeah, so there are a lot of work that I've done in Liberia. I'm also a member of the behavior change communication core team in Liberia. So I'm not very active now, but I was benefited from the trainings and I contributed to a lot of efforts in spreading messages across the health spectrum, developing messages for prevention across the health spectrum. Well, in Australia, I've been fortunate to work with the Assault on Single Resource Program, where I work as an intern evaluator. There, I work on the refugee health assessment guidelines. I evaluated that. And also, I work with Sister Works. Sister Works is a not-for-profit organization. I work with empowering migrant women who are migrant and of low English-speaking background. I work in the e-hub, where we develop training material for these ladies. We did a video clips for the ladies. I also did a needs assessment there, learning needs assessment. And I also evaluated the web app, because we developed a web app where the lady can log in, get our educational materials to use. So I did a user evaluation for the web app also.
Wow. Thank you so much, Rachel, and good to see you and being part of this show tonight. So let's pivot to rape. What is the interest and why you think talking about this is very important?
First, let's look at the act that leads to rape. So generally, we look at sexual abuse against children. So the World Health Organization defines it as an act that involves a child sexually, and that the child does not fully comprehend, and the child is unable to give consent. I mean, the child is not of the age of consent, as we know, as a child, and the child is not developed in terms of biological development, where you have a reproductive system and
Richard, before we come to that, I want you to first tell my audience why talking about this topic is important at this time.
Oh, okay. So it's important that we talk about rape for a couple of reasons. It's actually in my slide. Okay. So that's why I wanted for us to go.
All right, but then let's go to your slides. So tonight we're going to have a form of presentation. We'll put a few slides on the screen so that our audience will follow this, because the issue of rape is too much now. We have heard a lot, and so we want to take our time tonight to do some form of education on the subject so that all of us are involved in doing something about this very, very bad issue. So our folks at controls, please put some slides on the screen so that Rachel will be able to explain certain things to us. Go ahead, Rachel.
Slide number 1. Yeah, as I was saying earlier, we look at the issue that we term rape. Rape is part of a number of sexual abuses that occur against children. So I want us to look at, firstly, what is sexual abuse, defining the intents of children. So the World Health Organization defines it as either involve a child sexually, and that the child is not in the position to comprehend what the act that is being perpetrated against them. Neither is the child in the position to give an informed consent. And the child is not prepared developmental-wise in terms of physical development, biological development, in terms of mental development, to give a informed decision to say, yes, I want the act. And this act is violated against the child, is perpetrated against the child. And that violates laws of the land and social norms in society. So we go to the second slide. So as you were asking earlier, Dennis, why rape is a problem or sexual violence is a problem. as you see up on the slide, we got a number of countries graphically there in statistics label on those countries. So this problem is occurring globally. In fact, international bodies declare rape as a public health, sexual violence or sexual assault and rape, including rape, as a public health problem. And they also declare it as a developmental problem also. So we look at the graph, you see high income, we compare high income countries to the low income countries. For example, we look at Africa, most countries in Africa are low income countries. So we found out that the disparity, the difference that the margin, this is actually talking about the prevalence. So you look at the margin, for example, in high income country, you got 23.2% prevalence of rape, sexual assault actually. And then in Africa, you have like 36.6%. So yeah, so there are a number of factors why you see this statistics that this. So if you look at the other countries that are underdeveloped, like looking at Asian countries, the Mediterranean, you see that the prevalence of rape is the prevalence of sexual violence is higher as compared to the high income country. It ranges from 24 to that of 37% between there. So because in high income countries they are well funded, they have the resources. Apart from the resources, the citizens have high level of literacy. They have effective and functional public health public system. All right, responsive public system. For example, the police, if you call in Australia, if I took the phone line and called an ambulance or police, in 10 minutes interval, the police will arrive or an ambulance will arrive. So you can measure that the public system is more efficient, and they have necessary support services in place, and they involve with research. They're doing research to find out the causes and the gaps in programming along the line. They also have enough information database system to track the problems that are happening. The justice system are stronger to prosecute those who perpetrate the acts. So you see, that's why you see the disparity in prevalence. Next slide. So why we still looking at why is it a problem? Why rape is a problem? So again, the World Health Organization, they have this global estimate that they do of prevalence. So we look at the prevalence, childhood sexual abuse or rape, sexual victimization. We found out that girls are like 27%, while boys are 4% in terms of sexual violence that occur against girls and boys. So that's the global picture. But this data might not be the comprehensive. These are mainly drawn from projections and estimates. It might not represent the true extent of the problem. Like, for example, in Africa, there are literatures reporting that, a couple of academic journals reporting that there's scarcity of data in Africa when it comes to the prevalence of sexual violence against children. So sub-Saharan Africa, there are a couple of studies here and there across sub-Saharan Africa where Liberia is located. And there's no definite prevalence, as I said earlier, but study here and there suggests, and from police records, suggests that the problem is grave. This violence against girls are very serious, and most time it's unwanted and forceful. Meaning doing their first sexual girls are reported, those studies reported that most of the first sexual encounter in life were either unwanted or forceful. Yeah. So I was able to look at a couple of academic journals and literature and reports across Africa. I was able to get a few data from individual studies in a couple of countries, as you see up on the slide. Are we there on the next slide, Anthony?
Yeah.
Okay. So we look at East Africa, East and Southern Africa, where I was able to get a few data from. So they're saying that across East and Southern Africa, one in every 3 girls and one in every 4 boys, before they reach the age of 18 years, they suffer from sexual violence. And the shocking thing that I saw in one of the journals was more children in Southern Africa, in that of East Africa, are reporting, self-reporting either to justice system or medical system, and they are reporting sexual violence as compared to adults taking them there to report sexual violence. If more children reporting sexual violence against them. There could be a couple of reasons why the children are reporting it. Like I went on a study tour in South Africa a couple of years back, and as early childhood education, they integrate what we call accepted skills, or the child is able to speak or be intimidated by anybody, able to report any act of violence against them for that matter. So that could be the reason why you see the children are reporting themselves to police station and health facility, reporting the issue of rape against them.
And that may also have to do with, like you said earlier, high income areas. So when
Yes.
the income is a little higher, then children at that level, they develop those skills kind of faster.
Yeah, because when we go a little bit further, I want to explain.
Okay.
There are other reasons involved also. So I got some report from Zambia. So 49% of sexual violence survivors that were reported to a police station were under the age of 40 years in Zambia. And then we look at Kenya and that of South Africa. In Kenya, it's like 67%. In South Africa, it's 31% of children who were in recovery center. I think we have similar program intervention in Liberia that we're going to speak about later. So where the act has already occurred, and then they carry the children for recovery. So in that center in Kenya, it was 67% of children, and in South Africa, it was 31%. So in Kenya, again, it was important to note that 46% of survivors were also male under the age of 10 who were sodomized. In Ethiopia, there was 37% of children below the age of 11 years who were violated also. And we'll go to the next slide, please. So then I tried to look for some data from West Africa. I was able to get data from Nigeria, Ghana, and that of Sierra Leone in West Africa, looking at the prevalence and incidence of rape and the number of rape cases reported in children. So in that of Nigeria, the prevalence is because in different parts of Nigeria, it's not a comprehensive picture of the entire country. That's why Nigeria economy is much more stronger, and have literacy is a little bit better, but they haven't really put it on their national agenda to do a comprehensive study to find out the extent of rape nationwide. So there's from different studies, the prevalence were drawn from a couple of studies in different parts of Nigeria. So the prevalence is between 5 to 38%, which is also alarming. In Ghana, when I saw this one, I said, "Oh my God, this is a serious problem." So we're seeing that if you look at these statistics, saying that rape is not just a national problem anymore; it might be a regional problem also. So so in Ghana we have like 19, let's say 20 children being raped out of per 100,000 girls, about 20 being raped. and the age range from 0 to 19 years. In Sierra Leone, there's just last year, all right, just last year, 850 plus cases, 8,000, 8,500 plus cases were reported of rape. Of those cases, 2,579 cases involve children also. Then I look at Liberia. So I look at Liberia. I try to walk back and see the trend of cases in Liberia. So I went back as far as 2015 to get data. Okay, so I was able to get some data. So just in Liberia, just this year, 2020, between January and June, 600 cases of assault and sodomy were reported. That includes rape also were reported. And in January 2016, most of the cases that were reported in terms of rating, rape was the second most common case reported, and the number of cases reported at the time was 182 cases. So in 2015, UNMIL documented 150 cases, documented and monitored 150 cases in 2015. And of those cases, 78% of the victims were children also. And it was saddening to see that some of the children actually died of the consequences of rape due to the medical consequences. They suffer injury they sustained during the act. Most of the children died. There were two specific cases that were documented by that was put on the docket by, highlighted by UNMIL. Two of the girls died right after sexual assault. So that's the complication. So to consolidate the reason why rape is a serious problem, we look at the rape or sexual violence as a serious problem. It has long-term, short-term, and long-term negative impact on health, the economy, and that of social life. It has a negative impact. So let's look at that individually. We look at health, for example. So these children that are being raped, sometimes they contract sexually transmitted infections like gonorrhea, syphilis, HIV, among other, and sometimes they go on for life suffering from sexual health problems. Take, for example, I don't want to label, but if the wall of the vagina is interrupted, especially at a young age, it creates scars. There's break into the integrity of the wall of the vagina, and it creates scars. And the vagina is made in a way that is elastic. It should stretch. In terms of childbirth and sex, the vagina contracts, and it has the elasticity to adjust in a normal situation, in an adult situation. So if a child sustains deep injury to the walls of the vagina, it impairs the contraction in the future in terms of giving birth and sex. So sometimes they might resort to cesarean section. They might not be able to give normal birth per vagina. They might refer to cesarean section or operation, as we'll call it in Liberia, to get the baby up out of their stomach in adulthood. Or sometimes they might have painful sex life throughout their adulthood. And this can create relationship problems, which we would say on a social problems. They might suffer from infertility. I mean, they might not be able to give birth again because all the structures, the reproductive structure down there, the cervix, they are ruined because of the force, and then the child is so young, the reproductive set is not well developed and prepared to accommodate such act. So the force kind of damage those structures, which would, and then infection to go up into the uterus and then into their fallopian tube, which is supposed to bring the egg for fertilization. Those structures could be compromised by infection. It could be damaged by infection from especially when the case is not reported immediately for intervention, or medical intervention. So that child, that girl, goes on for a lifetime or giving birth. I've been biased, yeah. I'm an equity equality person. Let me talk about the boys. Okay, so the rectum is actually made for stooling normally. So if boys are sodomized forcefully, it could cause laceration to the wall of the rectum equally. It could damage the colon, which is the end of the large intestine, and infection. If infection is induced in the process, the infection could go systemic into the intestine, the entire gastrointestinal system. Infection could spread out easily. And the boy could easily die from that also. And the boy could have some embarrassing social problem like incontinence, or we call stool incontinence, that the wall of the muscle has been, and the wall of the anus has been damaged, and then they cannot hold up stool anymore, so that boy could suffer from stool incontinence. And we look at mental health because these situations are done on a very violent act, and it creates a lifetime of mental health problem. There's stigma and discrimination against in some quarters against people who are being children that are abused. That stigma goes for life. The children ignorance are defied at so early age, so they become their self-awareness and their self-esteem and their confidence to live is violated. So it causes serious mental health problems as time goes on. And the violence, the pain from the violence alone, it goes on for years with these children and up into adulthood. It goes there, yeah. So those are the health problems, why rape or sexual violence. So we look at economic problem. Children development. If you look at development indicators and definition of development indicators, child mortality, for example, is a development indicator because it speaks to human capital. It speaks to future human capital of a nation. So if you have huge child mortality, obviously your human capital is going to be impacted. Or if you have huge child mobility, in this case, if the child didn't die in the process or after the process of sexual violence, it will consider that to be some great on mobility. So if you have huge problem like that, you impact the future human capital of the country who's supposed to produce and goods and services. The economists will explain that better. Goods and services, will be hampered. There will be less productivity. So if the child has grown to adulthood and goes to work, and maybe saw a trigger, something that triggered them back to that violent act, they could lose days of productivity away from work for a couple of days to nourish their mental health state to come back to normality. So as I said earlier, mental health goes for a lifetime with rape. So that's could impact productivity. Also, if the child develops some complications, some health complications as a result of the rape, as I explained earlier, it could make them to have days of absence away from work, which we lost productivity, we lost income. The nation lost income that day. So that's impact the economy also. Socially, rape within itself is like a double for rape within itself is a crime. And then people who are raped, most likely children who are raped, most likely might go on to become rapists themselves in the future if the mental health situation are not addressed. They might go to be, for example, serial killer. They could be serial killer of the gender that raped them, that violated them. We see in some instances we find they're just there in neighboring Ghana in some part of 2000, early 2000. They were able to they were able to capture a serial killer who were raping females. So you could have those kind of situation, who serial killer raping other people and killing them. And because the mental health situation, that adult could go into drug and alcohol addiction as a means of relief for their mental health problem. And yeah, so that child could go into drug and alcohol problem. And in homes where children are repeatedly abused and the child doesn't want it anymore, and the child don't have that support system at the community level, or don't have the means to report what is happening to them and find intervention, the child who live away from home, who get into the street, who get into other acts of violence in the street, as a way to alleviate the pain, the suffering in their home at the hands of their violators. So those are those are some of the chief impact, long-term and short-term impact of sexual violence or rape on our society and individuals.
Wow. Thank you, Rachel. There's a lot to digest. So let's come back. And I know before we go into the prevention aspect, we want to dig a little deeper on all that you have expressed so that we can unpack that. And for ladies and gentlemen, if you are just joining us, this is Focus on Liberia. We are discussing mitigating the incidence of rape amongst children, and we want to be specifically talking about Liberia. So Rachel, sometimes I think that there should be a different word to describe when this act is perpetrated against a child, especially against a baby in diapers. Should there be any other name instead of rape? It looks like rape is even making it look fancy.
It's still categorized under the sexual violence. Maybe we can say sexual violence. We wouldn't call it anymore.
Right, because how is that sex?
It's still rape, and yeah. So it occurred because there are a couple of studies and a couple of reasons that occur. So some people have, like what I stated earlier, that person in their own childhood might have been violated. So they go on violating other children in the future too. That could be like like a study in South Africa I read on, where they took this guy, they did a study amongst perpetrators who raped babies in nappy. So they found out that these people, these pedophiles, and by the way, they call them pedophiles, people who have sex with children or violate children, they are called pedophiles, who love to have sex with children, they are called pedophiles. So they found out that they found a couple of reasons, but I've just stated few of them. So some of them found it as entertainment. It's yes, entertainment. They also found out that it's just a misfortune for the child. Some of them look at it as traditional reason, cleansing. They look at it as cleansing. Some of them want to assault their manhood. They want to have the opportunity to assault their manhood or the child. In some cases, it's power relationship, because I'm stronger, and then this child, I can subdue the child. So those are a couple of reasons why. And as I said earlier, it's a personality. It could be a personality disorder as well. Why these people perpetrate the act of sexual violence, rape, to be specific, against babies in nappies.
So anyway, you already stated, what really goes through the mind of such people. And we discussed the impact on the society, both on the individual and also the society. So now let's go to how let's go to Liberia, and that you've had, you give us the statistics also. And from the news coming out, I don't know if there's been any study done to see why these men in Liberia would do such a thing.
Well, there hasn't been a study that I know of for UNMIL and UNICEF and other people have looked at the data scoping of sexual violence in Liberia. And there's not empirical data to draw the clear relationship between the war and you mean it's the civil war to that of what is occurring now. But there's a logical assumptions that it could be because of the 14 years of civil war. People, people were free to do anything they want to do. Apart from that, we have our own norms in Liberia. You know, the sugar daddy thing is widely acceptable in Liberia. Sugar daddy having sex with 13, 14 years old little girls and giving the families some real income. So it's widely acceptable. You and I know that in Liberia. And early childhood marriages too is widely practiced. Early child marriages is widely practiced. So yeah, so those were the few reasons for this. Not as I said, in the Civil War, there was more than 700,000 women that were abused, girls and women that were abused during the Civil War, and nobody got to be prosecuted. Although in the Truth and Reconciliation Commission report, they said that that is an act that is not forgivable, and that act will be prosecuted. People didn't get prosecuted, so people walk in the street and see your abuser and say in the taxi with your abuser. In some instances, you even encounter your abuser at a place of service provision. Yeah. So people and there might be deeper reason. There might be other complicated and deeper reason that we don't understand. That's why I would like to call out for more research. I see in the roadmap. It's mentioned. Research is mentioned twice in the roadmap, and that's impressive. In the recent roadmap, there should be deeper understanding of the problem in Liberia. It could be contextual, and as such, if you understand the root causes of the problem, then you'll be able to intervene adequately. Even messages. I see there's a whole lot of aspect going to public campaign from the recent roadmap. There's so much emphasis on public information campaign. How do you direct? Yeah.
Yeah, so the Ministry of Gender, the government of Liberia has a roadmap.
Yeah, that's what I mentioned.
Talk to us briefly about that. If you can give us a little summary so that we can see where the government of Liberia is going, because we are talking about mitigating. So let's see whether there is some correlation between what we're saying here and what the government is intending to do.
So generally, the roadmap, I think, is significant. It's significant at this stage. I consider a roadmap as a frame, it's a skeleton that we need to put the flesh on, and the flesh will be the programs, the innovative programs we design. And again, as a person of research interest, I would like to say before some of the programs are designed, it should be evidence-based, it should be informed by evidence. What are the prevailing realities? What are the root causes of the situation we are faced with, so that the program can be tailored, so that we use the impact that is needed to mitigate our risk. So the roadmap address policy issues, strengthening policy, address strengthening system, and address networking, which if you look at the Center for Disease Control, the U.S. Center for Disease Control, and you look at the World Health Organization itinerary for managing rape. These indicators like producing policy, strengthening system, networking, they are in the context, they are in the confines of addressing sexual violence in the country. So they have a couple of objectives. I think like 3 key objectives that they have. And the first objective talk about empowerment. You look at the main thing that comes out of that objective is empowerment to mitigate the risks, which I think That's my own angle that I love mitigating. I think that we should intervene first to stop the problem instead of doing the fire truck thing after it happened and then we intervene. We should stop it. So there are a couple of things under that uh, they want to address. They want to look at the causes. They want to strengthen system, public service system. They want to hold duty bearer accountable, and that's one of the major thing. Holding duty bearer accountable. I think in this context, duty bearers mean, for example, like if you have a unit at a police station who's supposed to gather evidence on rape so that the evidence is substantial enough to convict a person. That team assigned to do such thing must be very very careful in gathering the necessary data. Because if an error occurred there, that perpetrator will walk free in the court. That's why we see some cases being people being acquitted. So I think this is very essential if they would really enforce this objective.
Right. As you said, it's a roadmap.
Yeah.
Maybe nobody will walk on that road or not. But let's go to the second part of it, which is the mitigation. All that we have expressed, or you have talked about. You talk about how bad it is, the situation, why it is, the impact on the individual and the society. So I hope this is not a hopeless situation. We are not helpless. What can we do?
No, it's not. It's not hopeless because we already have in Liberia. We already have a structure. We have a lot of opportunities in Liberia. If you do a SWOT analysis, you'll find out that we have a lot of opportunities. What do I mean when I say a lot of opportunities in Liberia now? Because of the political, how do I say that? Political energy in Liberia, you find out there are already existing structure at community level. When you listen to Facebook talk show, you find this other group, I'm from this other group, I'm from this other group, those structures are existing in communities, and those are good things at community level that we can walk through to mitigate rape. There's also we also have like the roadmap is an opportunity. We have international partners, and sexual violence is as I said earlier, is declared a public health problem. Okay, it's declared a social problem internationally. It's declared a public health problem internationally. So those are opportunities. We already have our partners who are interested in this. All right, and we have opportunity. One thing about the roadmap that is very unique that I love is the roadmap. The total cost is estimated at $6 million, and the one thing I saw in that was I was like thinking, oh, are we going to look up the donors again? But no. The major part of if they're saying they will do the domestic resource mobilization, which I think, there's opportunity in Liberia that we can generate significant income to be able to contribute to mitigating rape against children.
Okay, so let's go to the preventive measures.
Okay, in the first place, we want to know children, to be able to prevent it. You want to know how children respond to sexual violence. So the children respond to sexual violence.
Can we go to your slides? Or?
Yeah. So we go to the slide where we have why the response to sexual violence against children should be different. Are we there?
Yeah.
Yeah, so in the case of children are not adults, so children are different. So the way they respond to sexual violence is different, and as such, we must look at that and design programs that will be able to address the way they respond. So if a child, most times children are raped by people they know, people that they are familiar to, people they trust. Most times these children are abused by those people. And in some instances, the children are unaware of the act that is being perpetrated against them. For example, it starts little by little. You come and grab the child, put the child on your lap. The uncle grab the child, put the child on the lap of the neighbor, and rock the child. It starts like that little by little, and start to finger the child little by little, and then finally the penetration. Sometimes, in some cases, That's what happened. So the child is totally unaware of what is happening, of those sexual acts and advances. The child doesn't know it. If you listen to, I don't want to single her up, but I mean, it's gone public. So if you listen to a little girl born by a Liberian parent who is currently behind by the video or on the social media, she was at the age of 6. So once she reached 14, she began to judge between. That's a typical example. She reached 14 and then her mental state has developed, her awareness has developed. So she's able to judge, but there's something not right. Dad is saying this is the way to express it, to make me feel loved by him, but this is not right. What if I have a boyfriend? Well, I sleep with my dad and sleep with my boyfriend. That's, that those things begin to come out in her. So she was able to start to speak out at that point. So you see the gap from 6 years all the way to 14 years. So in most instances, the children are unaware of this act. They don't know that it's violating them in most cases. So children, they're not able to go and seek help themselves. Children are not able to go and seek help themselves. That's why you see in a developed country, the teachers in the classroom, they play a very key role to avoid abuse against children. So the teacher doesn't only teach the child, the teacher observes the child well-being while the child is at school. So the teacher knows this child, and the child being a happy child, and the way the child walks, the way the child talks. If the teacher see the child, for example, hopping on one leg or dragging one leg, the teacher is going to get concerned and ask questions, and ask a couple of questions. Why are you walking like this? What happened to you? So for example, so children are not able to seek help. So in the West, in some instances, teachers are the one who help the children to seek the help they need to get. So communities, that's what I said, we have to tailor awareness. Communities, we have to, anyway, we'll come to the prevention, I'll go there. So then the other thing, the child, sometimes the act is so painful, the child, it impairs the child's ability to communicate or disclose the act that is being committed against them. And in some instances, the children are threatened. They are threatened by these adults or the perpetrator. They are threatened. So the children are not able to speak out on that. So, yeah.
Yeah, next slide.
Yeah, next slide. So, so we already talked about a lot about the causes of this. So I will just run through this, comparing what child abuse and neglect. So as I said earlier, harmful practices happen in Liberia, harmful traditional cultural practices, early child marriage, acceptance of sugar daddy, or FGN, all those things. So in Liberia, we look at the services that are available, child safety services that are available. Like we look at early childhood education. We don't have access to early childhood education. We don't have safety system where the child, when the child parent drops the child off in the morning and school has not started yet, where the child will be until school hours start. That is absent. After school hours, when the parent has not yet come to pick up the child, where would this child be? Okay, and we look at infrastructure. Most of public buildings, places of congregation, churches, or schools. For example, the toilet facility, they are not pleasant. So for example, the child might go to church and want to pee or poo, and the toilet is not functional. Decide to go to the neighboring community or house to pee or poo. That child could be taken advantage of. In school, the same thing, the child could decide to go behind the fence in the schoolyard. A child could be abused. In public places, sometimes the male and female. Jackson, I'm doing a video call. Excuse me. Jackson, I'm on a video call. Please keep it down. So, yeah, sorry about that, my son. So, as I was saying, infrastructure wise, we need to look at, we really need to look at our current infrastructure, the public works ministry. That's why I didn't see the public works ministry in the roadmap. I was like, oh yeah. So when we're constructing, or when people constructing public places that will bring people together, they need to have a itinerary or a plan, a prescribed plan where they can be able to address some of the issues to reduce the incidence of rape.
No,
Yeah,
that is very important. I like that,
yeah,
because public works, or our facilities, the way we build things,
yeah.
safety measures are not factored in. That's very important.
There's this well known restaurant in Liberia that I visited. So I went to the toilet. So the male and the female enter the same cubicle. That's an opportunity. That male could hold your mouth and drag you in one. You know, they just put the picture female here, male here, and you enter into the same corner. You understand what I'm saying?
Yeah.
Yeah, that's an opportunity that a female could be raped. Where if a child and the parent went for dinner and the child decided to go and use the toilet, the child could be taken advantage of in that instance. And most public buildings and places of congregation are like that.
Mm.
So inefficient public service, on the civil service agency website, I don't know whether this document is still there, but it was there. There's an evaluation did in the Salif government of Liberia public service, measuring public service efficiency in Liberia. And they found a public service efficiency gap at 32%. So we need to improve public service. As I said earlier, public service has to be responsive. If you're given a piece of job to do, you have to go the extra mile on personal development. You can't just sit there and wait for instructions. You have to read about your scope, what you're supposed to be doing. And then you come up with innovative things to be able to do your job correctly, void of being bribed. Because in most public service, if you go for a service, everybody expecting you to bribe them. You know, like if I go for let's say tax, go to you want to do the tax something, and before you don't know who will help you to calculate. The person who will help you to calculate the tax payment want you to give them something. You know, I know I was running a local organization where we have to start to pay income tax. And I went to the Ministry of Finance. I was back in the days of Charles Taylor. So I had to give the individual there some money to be able to tally the tax and pay the taxes for the income. So yeah. So public service should be, I mean, you should do it because it is your job. You shouldn't do it because you're supposed to be bribed.
Mm.
Yeah. And inadequate budgetary allocation. So because there's so much problem in Liberia, there's so much social economic problems in Liberia, especially around children. There's so much competing priorities. So you find out that money that goes to protection for children is very minimal. Yeah, because the priorities are competing. So yeah, and then the culture of impunity, as I said, the civil war and up to now, people are not prosecuted for rape in the civil war. And in Liberia, people before then, people were not being prosecuted for raping people because of XYZ reason.
Mm. Yeah.
Yeah. So we want to intervene. So we look at primary, what is primary and secondary intervention. So primary intervention are those activities that you will do to stop rape from occurring in the first place in the population. So yeah, that's primary intervention. So for example, child care could be a primary intervention where government should subsidize child care. There are retired nurses in Liberia. They are retired service provider, public service provider. The government could put in the budget to start to get some grant to these to make these people to form their legitimate organization, and then establish child care organization, or community members who take turn in taking care of their children. I mean, today, Martha will not go see her today because she's supposed to take care of all the children in the community today, Martha and Sarah. You know, we could take turns on that. So a government can subsidize this program, and also corporate institutions will subsidize the program. The supermarkets, instead of why keep the product on the shelf, like food stuff that children can eat, why keep it on the shelf until it gets expired? So if you know, if you do your forecast or your sale, and you know you will not be able to sell that cornflake, you won't be able to sell all before the expiration. You could give part of you could take some and give it to the child care organization around the communities to have conflicts. At least the children can have something to eat while they're waiting until the parents come back from work or place or hustle. So that's an example of primary prevention. We're going to go look at a couple of things later. Secondary prevention will be the immediate care we provide after the act has been committed. So the act has happened. So there could be short-term to deal with those short-term consequences to reduce the impact of the act against the individual and their families. For example, like the police intervening, gathering evidence, as a medical team coming and doing the medical stuff, giving the preventive. We have something we call PEP in HIV. That is post-exposure prophylaxis, because the perpetrator, we don't know his HIV status, and even if we knew his HIV status, we cannot take a chance. You have to administer PEP to the person that is being raped. All right, so you want to do that. If the child is close to reproductive age, like if the child is in puberty, you want to give. You also want to give after morning pills. That's a contraceptive, emergency contraceptive after morning pill, so that the child doesn't conceive child for a rapist. Yeah, so those are some secondary intervention that we could do. So, but as I said earlier, we have to understand the context at which these things are occurring is very important that we understand it. So we should look at it from the individual level. What variables are there from the individual level? What are those variables at the individual level that make the person to be susceptible to sexual violence? For example, age could be a variable, because the child is young, the child cannot resist, the child is unaware, the child the child is not developed to resist in a whole full grown either. All right, sex too. Males are stronger, although the feminists don't want to hear that, but biologically, males have a little more strength than females, so they can be seduced easily. They can be overpowered by strength and abuse. So we want to look at those individual variables. What are the individual variables in Liberia that's making children more susceptible to rape? We need to define those things. We need to do a study to find out what are those underlying variables. Okay, close social relationship. As you said earlier, friends and family members are perpetrators of rape against children. So we want to look at the circumstances. What are the prevailing circumstances in Liberia? Most time parents go to work and leave their children home in Liberia. Like in the West here, you cannot leave a child even up to 15 years old to leave that child home alone. Is a problem. That's a risk you are taking. If the state finds it, or you get into trouble. So we have to draw a line where how old is the child before we can leave them home with other children. We need to know that. We need to draw a line. We need to find out what those things. And yeah, if an adult is not home and another adult cannot enter the house where the children are, they stay outside the house. The children don't even open the door. They talk to the people, to the adult. We need to look at those associated variables that influence individual relationship. That's come to relationship breaks. And we look at the community level. For example, the community level, what are those social determinants at the community level? Do we have services at the community level Are school are well organized and structured to protect children? Workplaces, are they well organized and structured? And neighborhoods well organized and structured to look out for each other? All right. It's drug and alcohol all over the place in the community that people can access easily. Drinks on children can drink it, adults can drink it, and then this abuse can happen easily. So we
Sometimes
need
I don't even send you to go buy the cigarette.
exactly we send our children to buy alcohol. So that's why we need that's why I didn't see the Ministry of Commerce in the roadmap also. I think they have to consider the Ministry of Commerce because I think that function belongs to the Ministry of Commerce, responsible alcohol serving. Like in Australia, I will have responsible alcohol serving. You see when the club is about to start, there's the dope people standing there looking at all the proof for age cards. I don't care how tall you are, how big you are, they have to see your proof for age card before you enter the club. And when you enter the club, there's the restriction on the number of glasses or alcohol they can sell to you. So we need to
Oh,
look into that direction, the Ministry of Commerce. And the other thing is the content. What type of alcohol are we distilling in country? And the proportion of
right. The alcohol
spirit.
percent.
Exactly, yes. So the proportion, what type, we need to restrict that. That way the Internal Affairs Ministry need to work harder for people who distill what we commonly call king juice in Liberia. We need to
No,
put some
you are raising
restrictions.
some important points as to who should be part of the roadmap. I hope the Ministry of Gender get in touch with you because commerce, who are the people that we find selling at children? And most of the time, you talk about the
Exactly.
susceptibility.
So
When the children go to sell, that's how they become susceptible to these predators and these criminals.
yeah. So for example, shops, almost all shops except for the Fuller shop I know in Liberia sell alcohol, except Fuller shop or people with Islamic background or staunch Christian. But most of the other shops, they're just convenience shop in the community. They sell alcohol. So we want to issue licenses. Maybe we need to put in a policy to issue license. A license you have to be accredited every year before you accept the license to even the wholesaler. If you go to the wholesaler to buy alcohol, the wholesaler will have to see your license and send that license to the Ministry of Commerce to look at your profile, whether you have any offense of selling alcohol to minors or underage children. We want to look at all those details. And we have to be brave to close down this job. Liberia is small. I've worked through the length and breadth of Liberia. See, for example, have the HIV program. At least I can say with confidence that the intervention to prevent HIV has made a significant impact in that you see people walking off voluntarily in the numbers, trooping in the numbers to get an HIV test done. So that's impressive. People consenting to get an HIV test done. Before I left Liberia, we had more than 10,000 persons who were enrolled on antiviral therapy treatment. We accepted to be enrolled on treatment. I mean, across the country, we accepted to take the HIV drug. In early 2000, you couldn't get people to even hear the word HIV before I said to accept to be tested and take drug. So Liberia is small. The population is small. We Liberia reach a point. I know one thing that happened in Liberia can reach a certain point where everybody can agree to something. For example, like the team on rape now, everybody's saying that rape is an issue. So the population is receptive to programs. We have receptive population. The polio campaign, those are lessons to learn from. The polio campaign done remarkably well too. The maternal mortality reduction as the programs that are designed has done well. We can learn from this program. I work with the Population Services International, where we did a branded condom, a Liberianized branded condom, the style condom. And you will be surprised, Dennis, youth were really responsive to buy that particular condom because it was a social marketing project. We sold the condom to children and youth, to youth, and youth were happy to buy that condom. Even adults were happy to buy condoms to protect themselves, from sexually transmitted infection. You'll be surprised the sales the condom make over time. So I think we have a lot, as I said earlier, we have a lot of opportunities in country that we can tap into to resolve the problem of rape at a community and society level. So at the society level, we have to erode some of the norms of this sugar daddy, early child marriage, FGM. We have to deal with those things. Government will have to address the economic inequalities that make parents to not be able to protect their children, and they have to leave their children vulnerable to go look for food. Government will have to do some things like job creation, empowerment, and all those things for government to do to address it. Do you have a question, Dennis, or we'll move on?
Yeah, we'll move on. Just talking about still at the community level here, if we're having parties and alcohol is supposed to be served, children are not supposed to be there. But these things are not really regarded back in Liberia.
Exactly. So we need to, that's why I say we have to change some of the norms now. We need to put in the restrictions to these things. I remember my son, we were in a shared accommodation in Liberia. At the time, he was like 4 or 5 years old. And I bought a Malta Guinness. You know, Malta Guinness is non-alcoholic. I was drinking the Malta Guinness. And because he has seen this similar bottle in the hands of the other resident within the shared accommodation, my son asked me, "Mom, are you drinking liquor?" And I told him, "No, this is some non-alcoholic drink." He said, "But at the same bottle." Yeah, but at the same bottle. So yeah, so we have to. There are a lot of things we have to shape, or if we want to protect and save our children. If it is a priority, we have to make the sacrifice. It's not just the government alone. It's from the household level, from the individual level, at the school, the community, churches. Everybody will have to make the sacrifice. We have to change the way we do things around children. We have to change that.
Let's go to our next. Ladies and gentlemen, let me announce to them that this is a teaching section on mitigating rape or the incidence of rape, especially amongst children. And that's what we are discussing. My guest is Rachel Beseji Chapin, who is joining us from Melbourne, Australia. Rachel, let's go to our next slide.
Thank you, Dennis. So we look at primary interventions, what we can do at these across the level, from individual level to society level. Some are long-term, some are short-term intervention that we can do. I just listed a few things, but there are other beautiful things that other countries are doing that we could learn from. I advise that we don't rush to design quick fix program. We should send key program people on study tours. We should train them significantly. We should provide training for them. And that's something that really shocked me, you know, like the inception of the WIA government. Acknowledge strongly what are what's the institution responsible, the CSA, and the Institute for Public Administration. I think they're responsible for building capacity, if I'm not mistaken. So I was really shocked that they didn't have like a induction training for people. I mean, people have, let's take one person, for example, like Mamesi Kawa, she in college, you know, or just graduated from college. We said, I mean, they deserve being trained. They deserve being trained, orientated into government service, public service. Public service is a whole school by itself. You know, it's a public service. The way public service function is different from international NGOs or whatsoever. So it's a whole school by itself. At this point, they should have a module. You have a module to help people when they get a new public service job, to orientate them.
Yeah.
So we'll go to our slide, right?
Yeah.
So at individual level, you want to introduce assertive skills in early childhood education. Assertive skills is a set of life-saving skills, self-management skills for children that they can be able to speak out and not be intimidated. They will not be passive. Not because they're in the presence of somebody and something is hurting them, they cannot say it. They'll be able to speak up at any place, at any time. They'll be able to speak up. For example, in South Africa, I went to South Africa sometimes in 2003, 2004, sometime there. Way back, I can't remember the exact year, but went on a study tour where they have Sun City. And the early childhood education, children were below the age of 10, and they knew that nobody, absolutely nobody, should put their hand in their trousers or in their skirts or under their skirts at that early age. And not even their own parent, after they pass the baby age, when they taught their parents, they trained the parents, they did training for the parents not to wash the children themselves. They start to teach the children to wash their own private parts. So that way, the children are not used to hands going to their private parts. So they used to only their own hands. So a stranger or not stranger per se, or any familiar, anybody else in the family or somebody touch that part, they will alarm. So they train them that way to alarm if anybody touch the private part, and they educate the children that the private part should not be touched, absolutely, not even by their own parents. And before I say of other family members, it should be only in the hospital, and even in the hospital, it should be in the presence, the doctor plus the presence of other people should be there before they allow somebody to touch the private parts. And it was amazing the way the children, they dramatized a scene, and it was so impressive. It was so amazing the way the children performed. Yeah, then the child care services, right? So if we say we don't have money, because I read one cost-effective study looking at rape prevention as compared to primary prevention, as compared to secondary and tertiary intervention. Primary prevention is more cost-effective. It saves government a lot of money. For example, if you prevent, you don't have to buy a reagent for the DNA machine. So much reagent. For example, you might have less cases and you use less reagent for the DNA machine, so you get to save some money, right?
Right.
You save some money, yes. Prosecuting cases cost money, so you save some money. Police going after, the police need few. The police need data assistance allowance. If the perpetrator ran away from Morel to Kanta, the police need to go there to arrest him, right? They need to look for him. If he going in one village, the police got to either get on the motorbike, and it costs money, it costs time. So you get to save a lot of money. So if you introduce the child care, it can be a very special way in Liberia. It doesn't have to be like the worst that's so expensive. And in our public schools too, we need to introduce child care. We need to annex child care to all public school system that government should subsidize, and child care will take care of before and after school care. Even if the mother, even with in some child care places, they take babies. They take babies because the mom, they get what we call permanent enrollment or casual enrollment. So the mom is always home with the child. The mom, or then the mom maybe have to go to some family funeral or something for that day, so that the mom can take the child in casually. So say okay, we charge $25 Liberian per day, or then government can pay $10 and then the mom pay $15 towards it, something like that. We could do that. It's possible that we could do that. So we look at relationship, at the relationship level, we need parenting skills. Like, yeah, I must admit, sometimes I shout at my children and then I catch myself, because I saw people shouting at me. That's our Liberian African way. So, and the children I assimilated into the Australian society where they don't see that thing happening to other children. So, like my son, if I do that, he get real pissed off, and tell me, start shouting at me. So, in Liberia, we say you're rude, but he's not rude, he's right. He's right to tell me to stop. That's not appropriate. So, yeah, we need to learn parenting skill. We assume that we know parenting. No, we don't know parenting. It's a whole thing by itself that we need to learn it. And you need to learn it. It could be attached to hospitals, First, the women who get cursed. People who get pregnant for the first time who are going to have a baby. The hospital who make referral for parenting skills, because the hospital, definitely they will go to hospital. Also make a referral for parenting skills. We can have local organizations, like when I heard that the legislature share $180,000, if I'm not mistaken, for projects. These are some of the money should go to some of these project parenting skills, paying for parenting skills for communities. It's important. The thing about parenting skills, it says a lot. It says a lot. You if you have good bonding, if you have parenting skills, good parenting skills, you have bonding with the child. You will not have run away children from home. Children will not be seeking love on the street. To run away, where we will have teenage pregnancy happening at early ages. A lot. It will save a lot of money and cost and time. We're going to save a lot of things. Yeah, so that could be a whole discussion about itself. So
I know.
Yeah.
And our time is fast spent, so we have to run through that.
So community public education, as I said, we don't just don't rape, man, don't rape. No, that's not a good behavior change communication message. A behavior change communication message should be consistent with the 5 C's. It should communicate an action. It should be consistent. It should be evidence-based. All those things. It has to be consistent. So before we do the public information campaign, we have to do research so that our education campaign is based on evidence of what is obtaining, what are those norms, what are those behavior, what are those attitudes, what is knowledge gap, so that we tailor our message exactly to address those situations. As I said earlier, they can learn from the HIV program, the maternal mortality thing, the polio vaccine. There's so much we can learn from to be able to develop appropriate messages. Infrastructure modification at the community level, I say a lot on that. Alcohol and drugs control, economic empowerment services for people. People don't have jobs, they're hungry, children hungry. A lot could happen. Even some parents could give their children up for sex at early age. That could possibly happen if the family is starving. So we need to bring employment services. We need to empower people with skills. We need to give community grant that will help people to sell small markets. Affordable housing. Yeah. Sometimes the parent can't afford, so they go start with other relatives. And in that house, the child is being abused. We need to have affordable housing system, public housing system. Society, we have to address inequalities around the economy, the health, education. We need to design policy. We need to make our public service efficient. We need to introduce what they call child check. Before you work for any institution that children will be part of, you have to go for a child check. The WFE just did some household data gathering. We could use that as a starting point to profile individual. If you have any record, or just doing something odd with a child, you shouldn't get a child check. And when you go for employment where children will work, you will not be employed. We could start just within government apparatus, all government employees, and this child check, government don't have to pay for it. You pay for it yourself. You pay. You start to pay for the child checks.
Pastor or choir.
Exactly. You have to get a child check. And I reckon that we gave this to an independent institution to do the child check. It's because they have to do a lot of data triangulation. They have to find out behind the person, like looking at where they live for the past 5 years, for example, or the past 5 years where you live, going to those communities and asking people about your character. So it's capital intensive. Perhaps we can introduce it, but it can be paid for and subsidized by government. Individuals can pay some money and government subsidize it, right? Like I saw in the roadmap, we have labeling. Labeling sex offender. They want to establish a database to label sex offender. If you pass into every shocker there, they have the data top pool. Perhaps we can introduce the data top pool in communities and paste sex offender photos there, their names and photo. Paste it on the data top board in communities. Just one side of the data top board, exactly for sex offender. We put it in frame. Make it nicely, put it in frame and put your picture, put your name. This person is a sex offender. You see that in the community alarm. And then we have to govern a lot of resources in country. We have to look in country. We have to look across our budget. Like we can piggyback the rape team on other intervention. Like we're building roads. We got road fund. We can piggyback You can piggyback and take small part of the road money to solve the problem. After all, who will play the role as citizen? Or if you guys also citizens who have been abused and get on drugs, for example, and plying the role, they're going to kill other people and then you have more problems. So it's better to carry healthy and sound role users.
Yeah.
And secondary intervention, I don't want to go into this too much, but it's just like you want to, what will happen after a rape occur. All right, so we want to do medical, we want to set up a good legal team, which Liberian government is already had planned to do. There's a lot in the roadmap. We want to have counseling services. We want to have safe home for these children who are going to be abused. We want to have accessible medical and psychosocial and legal services at community level. We want to have a crime reporting loop at community level where they can, even if they suspect you have the intent, they should report to you. They shouldn't wait for it to happen. They should report to you. We have that crime reporting loop at community level. Government want to subsidize legal aid. For example, that the Association of Female Lawyers, government have to subsidize them so that they provide legal aid to communities and individuals who will have problem with rape. Okay, we want to have witness protection. Remember, if you will go to lifetime imprisonment and some people are calling for capital punishment, if that will happen, then the rapist going to get aggressive to kill witnesses. So we want to have witness protection. Budget again, we want to increase budget. We want to make our public service efficient, avoid corruption. You should deliver the service. And the person raped and the person could report the case to the court, then you ask the person for $500. No, it shouldn't be that way. Well, that's why, there's this problem where we see that the society don't have trust in public service. These are some of the reasons why the society don't have trust in public service. If you have, if you work objectively and efficient for the corruption, the trust is going to grow. The population is going to have trust in public service. So I think, we are, and so just references there with on the UN, couple of research from a couple of authors. Yeah, so.
Richard, you really opened my eyes to other aspect of this rape thing that I've never thought of before. And I think, you really did, especially as you talk about the primary and the secondary prevention. What are those things that we need to look at? What are those areas and all the different areas that are involved in this rape thing? It is not enough to, as you said, to just come and say, oh, stop the rape. When the people rape, you must cut off their private part. Because if you don't do a root cause analysis of something, it's very, very difficult, if not impossible, to prescribe a solution. So I really want to thank you for this eye-opening lecture that you've delivered.
Dennis, thank you so much. And I'm working on my own organization here. I have done the business registration here in Australia. I just had the first interim meeting with the people that are nominated to be the board, to be members of the board of directors, because I need to form a board of directors before moving on to accreditation. So sometimes early next year, we're going to seek accreditation. So I have my own organization by Australian laws. It's registered, it's legitimate. And I'm waiting to help. I'm waiting to extend help to Liberia because I cannot get my eyes off Liberia because all my life was in Liberia, except for the last 5 to 6 years out of Liberia. And I worked extensively across all counties. I mean, I've worked in all counties in Liberia. There's not a county that I didn't go to conduct a workshop or awareness in Liberia. I went as far as Buto. And I went as far as Buto, the famous Buto.
And that's the part of my life that I'm still struggling with, that I've not been able to see even half of Liberia. So, so that's really a privilege.
Yeah. So I have a solid background in working in Liberia. So I'm waiting. As it is now, I can't leave my children and travel. I don't want to be charged for child neglect. So, but I can work virtually. I can work virtually. Yeah, so I'm willing to offer my expertise. It could be for free. It could be for a cost, depending on the extent of expertise I will offer.
Right.
So yeah, so I'm willing to work with Liberia as my contribution. And by the way, I owe the Liberian government $12,000 for for my salary that was paid while I was away studying. So I can work for my salary. I can work to pay that salary back. I might not have the cash to pay back, but I can offer my expertise to pay that $12,000 back. The library, I'm willing to work with the general ministry if they are receptive to work with me. I'm open and willing to work to be able to pay that 12,000 back. It's a burden on my heart, and I want to pay it back.
Thank you so much, Rachel. Your final thoughts on this whole issue that we are discussing. Let's just wrap it up and hear
Yes. So,
your parting comments.
so yeah. So my final thought is that we have the opportunity in country in terms of structures. What structures are available from household to community to that of the society? We have all the structures available. We have experience with other programs that we can tap into. We can learn from this program and bring it into mitigating rape. We can do that. There's something that was in the roadmap that I was shocked. Education ministry is giving just 1% of the budget. I think that they should look at that again. If we're going to introduce, we're going to consider safe space, protecting children before and after school. I think that 1% is on a cost. So they should look at that. So I think, again, we have a lot of opportunities in Liberia to mitigate rape. I know Liberians are very receptive to program intervention. It's not,
Rachel, let me stop you. And that's one thing that you said that really resonated with me. And I'm like, the way you look at this positively, like Liberians are receptive to programs. And you made mention of the enthusiasm, the political awareness. People are forming groups almost for everything.
Yes.
And you said, the community is small. And you also made mention of other programs like we can learn from, like the polio program, the HIV program. Nobody has presented this thing to me the way you did tonight. I'm really, appreciate your time and the expertise and the skills and the knowledge. Experience really is good because you work in the area, you've seen firsthand how these things happen, and you are able to relate that tonight. Just I wanted to say that before you end your final thoughts.
Yeah. So we can do it. We can do it. We can do it. Liberians can do this. We can mitigate rape. We can create safe environment for our children. We can do this. That's why I want to say we can do this.
No, I believe we can. I believe we can do it. So thank you so much. We want to thank our audience, even though there was not much interaction because we intended to make this more teaching. Rachel is available. The slide that we presented is also available. If you want to get in touch with Rachel, you can do that directly, or you can contact us, and we'll be able to link you. And if you are at the Ministry of Gender, if you are at in the government of Liberia, anybody associated with these kind of issues, and you need some help or you need some collaboration, please, Liberia is for all of us, and we all owe it to our country to make it better. We can't stay in foreign land forever. The more and more people leave out of Liberia, there is a brain drain. And so we need to go back and fix it. And we really, really rely on the people that are the gatekeepers, people that are already helping to be able to open themselves up to all of us so that we can make our contribution as we are hungry and willing to be able to contribute the little we can. What we are doing here tonight is part of that contribution, and we are happy that this program will be relayed on Besu Radio in Wheeler, Mount Gibby County, and there's people in 9 different counties, including Riverside, where Rachel comes from, will be listening.
Yeah. I missed the Sester River crawfish and the Doma,
I know. So thank you so much, Rachel. Tomorrow at 12 noon, we're going to be having Councillor Vani Shema, who will be talking to us on referendum 2020. There's a lot of things to unpack about that referendum. We need the education, we need the awareness. And so Senator from Cape Bound, Vani Shema, Councillor Vani Shema will be here. And at 3 o'clock Eastern, we're going to have our FOL Marketplace, that's our business and finance show, to break down the numbers. We started with the numbers, the economic indicators. We're going to continue, look at the CBL website, look at some of those numbers and explain what they mean. Then at 7 p.m. is our debate night. We're going to have the collaborating political parties versus the Coalition for Democratic Change. So you have these two coalitions or these two group of parties will be debating on election 2020. You sure don't want to miss that. Until then, from all of us here at Focus on Liberia, my name is Dennis Jah, saying thank you so much for watching. Good night and God bless you. Don't forget, COVID-19 is still around. Observe all the protocols. As we leave, we're going to leave you with that song that says, we are all Liberians. Whether you come from River Cess, Bapulu, or Sino, we are all Liberians, and what we want best for the country is that it be that glorious land of liberty. Good night, and God bless you.
We are Liberians. Liberia is our home. Liberian people. Liberia.